Good afternoon, everybody. Welcome to this briefing. We've got good news. We'll hear today from, amongst others, the President of the Committee for Education, Sport and Culture, Deputy Andrea Dudley-Owen, and it's Deputy Millie Dudley-Owen, as I call her. But anyway, she knows who she is and you know who she is. She will tell you about schools. She will be talking you through the process and answering questions about matters relating to education, because it's a big day on Monday. The schools, preschools, colleges go back. We know the children in year 10 and above go back the following day. But the mechanism of thousands and thousands of young people going back to school begins on Monday. Monday's a big day, not only because of the schools, because we're moving in Guernsey to stage 2, which means businesses that haven't been able to open until then will open. People that haven't been able to go back to work will go back to work, and the number of bubbles will be able to increase. Activity will be able to increase, because we're trying to exit this lockdown in big bite-sized chunks. And this is the biggest bite-sized chunk that we're coming to in just a few days. Now, it's a bit like a race. We're winning the race. The results have been spectacular, and Dr. Brink will speak more about that in due course. But we've still got to be vigilant. It's a bit like, I remember watching a race years ago where the athlete thought 5 yards before the finishing line, he'd won it. So he started cheering and everything else, and then somebody come up and beat him because he relaxed too soon. We can't relax too soon because this blinking horrible thing called the virus won't relax. So we've got to continue to be vigilant and do all the things that we need to do. We are on the right track. Can I remind people, I know you won't need reminding because you're good, sensible people, and you've reacted so well to the challenges over the last year and the particular challenges over the last 5 or 6 weeks. But I can just remind you, we've got one of the highest vaccination rates per capita population in the world. We've had more freedom than most other jurisdictions over the last few months. We don't want to go back in relation to that. We're moving forward. We are a sensible, proactive group of people. And there was a gentleman called John that contacted me this morning to say, and rightly so, and he and his wife are fully supportive of it. You say that you support police officers and teachers and medical people, etc. And he's 100% in support of that. But he also said, what about the people who work in the supermarkets? What about the people that serve you? What about the people when you go and pay at the desk? They're there 7, 8, 9 hours a day. They're always cheery. They always are there. They're in the front line. They're much at risk as anybody else. So he would like to say on his behalf and his wife's behalf, thank you. And I would like to say on behalf of all of us, thank you to those folk, because you've done a great job in very difficult circumstances. Now, the rules are still complicated. We don't pretend they're perfect. We're trying to get to a situation whereby we go to stage 2 on Monday, and then 2 weeks thereafter, if all is well, we move out. We go to stage 3, when internally the restrictions are removed in the greatest measure possible. So we please ask you, as you've done so diligently over the past weeks, to continue to follow the rules and regulations. Now, as I say, Deputy Dudley-Owen will be on the panel. Deputy Soulsby at 1:45, whatever questions are being asked by our able media people, we're going to come out of those because Deputy Soulsby will be chairing a session of questions from children. Do you remember how interesting that was when she did it some weeks ago? And we welcome their questions. And also, Dr. Brink will do, as I've already said, what she will do. And the Chief Executive, Paul Whitfield, will talk about some of the rules for stage 2, how they've developed, where we are with them, and what questions we're constantly asked. But I ask you to be patient. We're all running towards that finishing line. Let's make sure we can get there as quickly as possible. Dr. Brink.
Thank you very much, Deputy Fairbrush, and it is a really good day for us. We're now on 6th consecutive day with no new cases. That's really, really positive. So we completed 6 whole days with no new cases, and we're now on our 7th day. So as ever, data moves so fast. So if you look at our report that we're putting out on our website, you'll see that we had 9 active cases. As I've said to you before, our reporting goes from midnight to midnight. But as of 12 today, we've now recovered another 3 cases. So we're down to 6 active cases now. So it has really been an incredible response, and we owe a huge debt of gratitude to Islanders. It's been fantastic. It is fantastic. We need, however, to stay vigilant. If you do have symptoms, come forward and get tested. You're not going to spoil anything. We need to detect any positive cases so we can manage them appropriately. A really important message. But of course, we do still have one person in hospital, and that's important. So we've got one person in hospital, and during the second wave of infection, we have lost one person. But in total, 511 cases and only 6 active cases left. So a really good day for us today. So if we go to the next slide, as always, you all know how much I like evidence, and we have been looking and analysing the efficacy of the interventions. And I think it's really important that we have an ongoing and honest, open appraisal on every measure we put in place. We look at what the effect of that measure is. And so this is the lockdown efficacy. Now, you've seen this graph before, and what it shows in the green columns, you'll see an arrow there, is when we went into lockdown. So you can see from the green columns, there was a dramatic decrease in the number of contacts per case as we went into lockdown. So the green columns are the contacts per case, so each case and the number of contacts they had. What we have superimposed on this graph today is the number of cases. Now, as you're all aware, we reached our peak number of cases towards the end of January, beginning of February. And in the amber line, you can see how our cases went up during that period of time. But at the same time, the number of contacts per case was going down dramatically. Now, that shows just how effective the lockdown process is. We were able to stop those chains of transmission occurring, and that's what has got us into this really favourable position that we're currently in. So again, that's down to the community, and I think it's really good to see the response in a graphical format. So if we go on to the next slide, what we've done here is we've analysed the whole of the second wave, so all of the cases that have happened from the 22nd of January until present. Now, what is really important from this data is 74%, so almost 3/4 of the total number of cases were detected through our contact tracing process. Now, that is really good. So these were people that were put into isolation because they were known risk, and we've done contact tracing around those cases. So if we then look at the symptomatic, the next most common is someone, the people who were symptomatic seeking healthcare, and that was just under 1/4 of cases, with a spread on care homes, workforce screening in the other few percent. But from my perspective, looking at that and seeing that we detected almost 75%, almost 3/4 of our cases through contact tracing is extremely positive and shows the importance of a thorough and effective contact tracing process when you're controlling a wave, particularly, as in this case, a wave caused by the variant virus. So if we go on to the next slide, what we've also done here is we've looked at the demographics. We've looked at the age and sex of all of the cases that have occurred in the second wave. Now, although not shown here, if I just remind you, in the first wave, most of the cases occurred in people over 70 years of age. And indeed, the highest number of cases occurred in females over 85 years of age. What we see from this graph here is we show that the age was far younger in this wave. So we also are seeing here the protective efficacy of our vaccination program and the lower impact on the more vulnerable in our society. And indeed, the most cases occurred in males aged 10 to 14 years of age. So I think that not only gives you information of what happened during this wave, but also shows the efficacy of the vaccination program in protecting the most vulnerable from the morbidity and mortality associated with COVID-19. And the final slide that I've got today focuses on the vaccination program. Now, as you know, we collect the data from the week before, all of the vaccinations that occurred, and this shows the data up to the 28th of February. And during that time, we delivered over 22,000, about 22,500 doses of vaccine, with over 16,000 first doses and over 6,000 second doses. And we always calculate our dose per 100 population because that is an international comparator that you can all use. And you can see we're at 34.2 per 100 population. Now, At the moment, we also have immunised more cases through the community vaccination centre this week. And in fact, we've immunised a total of 1,079 more people through the vaccination centre this week. So the total, as of close of play, of number of vaccinations that we've delivered was 22,601. So really, really good progress on the vaccination front. We currently vaccinating groups. That's a really big group. We think there are about 6,600 people in that group. We're calling people in blocks of 600, and of course we're administering this through the community vaccination centre. So that's my summary. Thank you very much, Deputy Fairbrass.
Thank you again, Dr. Just a couple of things to mention before I pass over to the Chief Executive, Paul Whitfield. The Alderney, of course, our good friends in Alderney, they go to phase 3 or stage 3 on Tuesday. And next week, we're going to broadcast on Wednesday and Friday rather than Monday, Wednesday and Friday, but at the usual time of 1 o'clock. Now, Mr. Whitfield.
Lots of businesses will have been preparing for Monday to get back open again and welcome customers that have not seen in several weeks. Stage 2 is a very positive step forward, but please, I want to stress again that it's a stage we have to go into, taking every precaution in line with the guidance. If you haven't notified us yet, but you're intending to open in stage 2, please fill out the form on the business section of our COVID website. Remember, if you have any questions, first read the guidance that is published online. If you are still not sure how the guidance applies to you, you can email trade@gov.gg or indeed call on 01481 717 245. Since Wednesday, we've had more questions come into us about specific areas, and I'll deal with a couple of those. And anyone who works in other people's households, for example, cleaners or tradespeople. Now, I touched on this a little on Wednesday, but we've looked at the guidance again, which you can find online and is extremely detailed. And actually, I'd like to give some further clarity on that today. Cleaners can work in people's houses, but they should avoid being in the same room as the householders. They should also not go to anyone's house if that person is unwell or self-isolating. The same goes for tradespeople, carpet fitters, TV repair firms, any kind of similar work. Keep in separate parts of the house from the people living there. Wear a face mask, wash your hands. If you're working in a house that's completely unoccupied, then of course you could have more workers, up to 20 indoors, provided there's room for you all to socially distance. We've also had questions about people who work from their own homes and see clients, hairdressers, for example, whose customers come to see them at their own home. So again, we've looked at this really carefully. Now, clearly, in those cases, it's not possible for customer and you to be separate in separate rooms or even socially distanced. So as this would mean close and prolonged contact in a household with people from outside your own household bubble, I'm afraid that isn't permitted in stage 2. We've seen this variant spread quickly in household settings. And close contact is, of course, more risky. Indeed, when we've analysed 150 cases, 72% were acquired in the household. So when it comes to combining close contact work and someone's household, it's something that has to wait until stage 3. But please remember, if we carry on doing as well as we are in stage 3, really isn't very far away. Designing these rules and working out where to draw the line really isn't easy. Indeed, it won't necessarily feel fair, as in stage 2, it is still about limitations of contact. As Deputy Fairbrass has said time and time again, it's not perfect and we're not aiming for perfection. We just need some boundaries in this phase that can get us safely through the next couple of weeks, because we know there could still be COVID in our community and we don't want another breakout that sends us back into lockdown. We want to be coming to you again in a couple of weeks to say stage 2 has gone really, really well and we're now ready for stage 3. We don't want to be saying that virus has taken hold again and we need to go back into lockdown. And we know that's the last thing you want to. So hopefully in this short period in stage 2, it's important to be vigilant and monitor the impact of these easing of restrictions. On that point, the other thing I would ask all of those going back to work and employers who are opening up again, Please do not work if you're unwell. If you have any COVID symptoms, no matter how mild, stay at home. If it's your staff member who isn't feeling well, don't pressure them to come into work. We still receive calls into our helpline from people who say they're being put under undue pressure to work when they should be staying at home and reporting their symptoms. Please think what the consequences of that could be, although we recognise it's difficult when you're trying to staff your workplace. As we move into stage 2, the final financial support scheme in place for business will change too. With more sectors being able to operate, the support will target those who are less able to trade, so please be aware of that and look at the business support section of the COVID website for details. As more things open up, it also means the main swimming pool, the gym and some activities for adults at Beau Séjour will open up again on Tuesday. But as it is stage 2 and the site will still be the home of our community vaccination centre, there will still be restrictions and it will feel different from normal. But again, it's another step forward, which is very welcome. Finally, I gave you an update earlier this week on the rollout of vaccines for those who aren't ordinarily resident, and I can say a little bit more about that today. Everyone who's eligible and who came forward to us will receive an email. Those will start going out this afternoon. They will be sent out in age order, starting with those who are over 65. If you're not in priority groups 1 to 9, i.e. over 50, you won't be vaccinated just yet. You're still in the bailiwick. If you're still in the bailiwick when we get to phase 2, those priority groups that come up after group 9, you'll be prioritised accordingly. When you get your email, it will have a form for you to complete and ask you to email back. You don't have to sign it initially, just fill out the information and email it back to us. But before you arrive for the vaccine appointment, then you do need to print it off, sign it and bring it with you. Once you get your form by email, we'll contact you to arrange your appointment. Should you have any reason why you can't complete the requirements online or print off the appointment, then please contact us directly. If you leave the bailiwick between your first and second dose, please let us know so we can cancel your next appointment. You'll need to organise that elsewhere. Thank you, Deputy Fairbrush.
Thank you very much, Paul. And now we'll hear from the President of Education, Sport and Culture, Deputy Dudley Owen.
Thank you, Deputy Fairbrush, and I'm really pleased to be here today. Good afternoon to everyone watching. I'm delighted to have been invited to be on the panel today to provide an update on education settings reopening to all students next week, and also to answer questions for some young children and people. Everyone involved in education is so excited to welcome all students back next week. This has been an incredibly challenging time for parents, and trust me, as a parent of school-age children, I know how difficult it is to balance distance learning with all the other demands that parents have to juggle. But I also know how challenging it's been for our amazing teachers, school staff and education officers who have worked so hard to ensure the programme of distance learning has been a success. Parents know how hard their children's teachers have worked to support them, and our committee wants to make clear just how much their efforts are valued. From our perspective, the education profession has epitomised the Guernsey Together ethos throughout lockdown. Through their commitment, we have kept education settings open for the most vulnerable students and the children of essential workers. The island simply would not have been able to maintain critical services for the community during this challenging period had they not done so. There is no other way to describe the significance of their efforts. I also want to make a special shout out to the Sports Commission and the Youth Commission for the support that they've given during the lockdown, helping to keep our kids active and safe. Thank you for your valuable contribution. There are, of course, many other sectors and related agencies, such as the staff given across the island, who are equally deserving of praise. But I'm sure I can be forgiven for briefly focusing on the workforce for which our committee is responsible. As we head towards next week, when all students will return to schools, the College of FE and early years providers, education will look and feel very different to what everyone is used to. I know a huge amount of work has been done by education staff and Dr. Brink and her team, and we're extremely grateful for the way in which Public Health has worked with us to develop this suite of measures that will make sure education settings are operating in a way that is as safe as possible. These measures will include classroom bubbles for primary schools and years 7 to 9 in secondary, with year group bubbles for older students. The recommended use of face coverings for older students and staff. 1 metre social distancing wherever this is possible, and of course being conscious of this being a challenge to ensure at all times, particularly for our younger children. Staggered start and finish times. Enhanced cleaning regime for education settings. Limited school transport service to minimise contact between students. A specific public health testing strategy for staff in education, as well as for those older students who are in year group bubbles. Earlier this week, all schools contacted parents directly to explain in detail the specific arrangements in place for them in terms of staggered start and finish times and instructions for parents around pickups and drop-offs and how to apply for school transport. If you didn't receive this information, please can I urge you to contact your children's school. They will be happy to help. If anyone has further questions about how education settings are going to operate during stage 2, I would encourage you to review the frequently asked questions document published on the education section of the state's COVID website. We know that there may be some parents who are very concerned about sending their children back to school. It's only natural. But we would encourage all students to return and can absolutely reassure the community that we wouldn't be reopening to all students unless we felt it was safe to do so. To coin a Dr. Brink phrase, nothing is ever risk-free. But we have been led by public health advice, and the measures in place make it safe to return. If any parents, however, really don't want to send their children in next week, I would urge you again to contact your child's school to discuss this. Schools will take a sensitive and supportive approach in those circumstances. And finally from me, as Deputy Fairbrush said, Alderney will move to stage 3 on Tuesday. So for St Anne's, this means that from Tuesday, students and staff will experience a much more normal school experience. This is great news, and I hope that they all enjoy being back to that level of freedom and that we in Guernsey can follow suit soon. And thank you, and I'll hand back now to Deputy Fairbrush.
Thank you very much, Deputy Dudley Owen. Now we've got question and answers. We're going to, at 1:45 precisely, we're handing over to Deputy Salisbury for the children's section. But that gives our first team media the chance to ask their questions now. So if they, in the usual time-honoured form, would raise their hands so I can call them. Yes, Juliet Poutot from Guernsey Press.
Thank you, Peter. I think everyone was quite interested to see yesterday the announcement from tourism that for the entire of 2021 there will be no cruise ships coming in. I was just hoping to try and find out why the decision was taken so early, and also does this mean that we're saying with confidence at this stage there is going to be no tourism in Guernsey then in this summer and autumn, regardless of what happens next?
Yeah, well, let me just say in relation to the second part of that question, the answer to that is no, that's not right. We're not saying that at all. We're hopeful that will, in fact, there will be tourism in the summer. We're addressing, as I said publicly before, a paper that we'll receive next week, which we'll consider thoroughly next week at Civil Contingencies, and then hopefully the week after we'll have an announcement. I expect to be able to make an announcement the week after. So I hope that's the second part of your question. As to why they made the decision then, well, it was made by Economic Development. I can understand it because cruise ships need to know months in advance whether they can come to some particular venue. So I understand the reason for their decision, albeit, or the likely reason for their decision, albeit I wasn't party to their discussions. Ewan Duncan.
Good afternoon, Ewan Duncan from BBC Guernsey. A question for you, Dr. Brink. I know you've touched on the vaccination programme and we're now on stage 6 of that. Sounds like an incredible amount of people to get through, over 6,000 people. How is it actually decided the people who fall into that category who do have underlying health conditions? Is this compiled, the list compiled with the help of GPs? I received a call from a member of the public earlier who told me that their medical condition is not actually diagnosed within the with what you were asking for in stage 6, but they were told just in the winter period to get the flu jab. So they're saying, surely if I'm vulnerable enough to be considered to get the flu jab, shouldn't I be vulnerable enough to be in stage 6 of the vaccination programme?
So to answer the first part of your question is, we're not only getting information from GPs, but we've also been getting information from our specialist clinics. So, for example, the diabetic clinic, our respiratory physician, and so on. So we're getting information from multiple data sources on vulnerability. With regard to people self-certifying themselves into the vulnerable group, obviously we've got a limited amount of vaccination. But what I would say, if someone does have particular concerns that they feel they should be in the group and they feel they've been missed out, is to discuss it with their GP. We've got very good links with the GP practices, and if they have any concerns, they will certainly discuss it with ourselves in public health.
Thank you. Jim Delbridge.
Thank you, panel. Just a quick question. Sorry, Jim Delbridge, Island FM. Quick question regarding critical travel licenses. I wonder if you could shed some light on this regarding people moving to the island, both to buy property and live in the open market, and also partners of local residents looking to relocate here. With the island beginning to open up and the importance of stimulating our economy with new business, could the panel explain the situation at the moment, please, and how it's likely to progress?
Thanks very much, Jim. Well, in fact, again, we've got a lot of business on next week. In that, one of the topics that we're already looking at, we've discussed it earlier. We want more detail, and then we're discussing it, I think, on Tuesday. So that will be an issue that we're going to address. Perhaps, Paul, you might want to add a few words on that.
Yeah, no, I think that was a good summary of where we're at. But there is it's not quite as straightforward as it seems. Obviously, we've got high numbers potentially wanting to come in and support our hospitality sector, as well as some of the cases that have just been outlined. So having to accommodate that and at all times maintain how we've gained our positive position is quite a complex issue. And the CCA are working really, really hard, and they'll be seeing a comprehensive paper on Tuesday to hopefully help make decisions from that.
Thank you very much, Paul. Matthew Leach, your question, please.
Thank you very much. A question for Deputy Dudley Owen. Will the distance learning programme stop completely when students return next week? And what kind of handover will there be from distance learning to a return to the classroom?
Thank you for your question. The distance learning, the active distance learning stopped on Wednesday this week, so that teachers were able to move to the analogue or face-to-face learning that we're completely used to. So work has been set for students to take them through the Thursday and Friday today, ready for going back into school on Monday. There's no intention to continue the distance learning because we want all children, wherever possible, to be back in school, because in terms of mental health and well-being and socialising, that really is the best place for them, getting back into a routine and getting back into what school life, all the benefits that it can offer.
Thank you very much. Hamish from Channel Television.
Thank you. Apologies, but I'm going to return to the question that Juliet raised a minute ago. I have been approached by a group of business owners involved with tourism-reliant business.
Yep.
They say the decision to not allow any cruise ships this year has taken away much of their hope for this year. And they're also worried that it will leave Guernsey vulnerable to competition from other places if vaccine passports and that sort of thing allows for travel towards the end of the year. So the first part is whether you can reassure them on that point. And what they're also asking for is a guarantee that they will be financially supported in the same way that hospitality has been, for example. And if you could give an outline on what that support may look like.
Okay, well, in relation to the first part, again, I come back. It was Economic Development's decision. I actually think it was the right decision because they need to give notice. But I know they've made it very clear that the cruise ship business, if I can call it that, is going to be exceedingly welcome back next year. And because of where we are, the facilities that we offer, we believe that if there is competition, we can deal with it fairly. And we believe other jurisdictions will find it very difficult to open up any more quickly. They want to open up safely than we have. As to financial provision, that's a matter for policy and resources. Deputy Salisbury is the Vice President. I'm the President, so you've got two of us here today. We're looking at financial. we're looking at whatever financial assistance we can reasonably give. And of course, a great deal of financial assistance has already been given to the hospitality sector. The financial provision that's going forward now, I think, till next March, in part in relation to that. But of course, we'll look at things. I mean, we have ameliorated, varied our decisions as we go forward as circumstances change. And I've no doubt that we will do that in the future. I'm just looking at a question. Juliet, your second question, please.
Yes, I've seen a lot of discussion this week about obviously restaurants opening under strict rules next week. And some people seem slightly confused about why it is safe to obviously go to a restaurant and sit down at a table with 10 people without masks, but they can't meet up with family and friends in the open air in their own gardens. Can you possibly explain to people who might be struggling to understand the differences there?
Yeah, I'll come to Dr. Brink in a moment, but the answer is, as one of my colleagues has said before, we've said on various occasions, Mr. Whitfield said it today, these rules aren't perfect. We're trying to get the economy working again. We're doing it, to use my phrase, in quite large bite-sized chunks. And we believe that we're striking a balance between the two. Now, we don't pretend it's perfect. We don't pretend that everything can be worked out theoretically in some kind of learned treatise. We're doing it on a practical basis. But the overriding consideration throughout is safety. Dr. Brink, do you want to add anything?
Other than to completely agree with you, it is the safety, it's the evidence about where the virus was transmitted during the second wave, and to balance that with giving people as much personal freedoms and ability to move around as possible.
Thank you very much, Dr. Brink. Ewan Duncan.
Yeah, question for Dr. Brink and perhaps Deputy Dudley Owen. Can you talk me through the Public Health Developed Education testing strategy? I believe teachers are to be tested once a week. And I suppose, how long will this carry on for, and how long is it financially possible to carry on with it, bearing in mind it might end up being cheaper, less labour intensive and time consuming for those teachers and the testing team to actually vaccinate the staff more quickly?
Yeah, well, I'm going to come to Dr. Brink first, then Deputy Dudley Owen. But in relation to your very last point, we have said repeatedly that we are limited as to the degree of flexibility we have with the vaccines because of the way the agreement we got with the United Kingdom authorities. But what we are looking at very, very much is that once we got through this first phase, that we will be able to then vaccinate teachers, police officers, etc., as in an early part of the second phase. But Dr. Brink.
So thank you very much. So Deputy Fairbrush is entirely right. The vaccination programme is to prevent morbidity and mortality, and we need to keep focusing on that. With regard to the testing programme and teachers, we don't envisage this going on indefinitely. What we're looking to is having this testing programme operational as we move through phase 2, possibly into the early parts of phase 3. And I think that's important when we consider that. It's going to be a PCR-based assay. We're testing teachers, and then we're also testing some of the older children who are in year group bubbles rather than in smaller class bubbles. So it's really focused on detecting infections so that we can manage them as quickly as possible. We've done large amounts of testing this week, and we've found no residual positives within those groups that we've tested. So that's a really encouraging result. But we're going to keep testing until we're happy that we're phase 3 and we've moved into phase 3 safely. But this is not something that we're envisaging going on for months and months. It is a finite programme.
Thank you. Deputy Dudley Owen.
Thank you, Deputy Fairbrush. I'm very supportive of the measures that are being undertaken in order to get our children back into school as quickly as possible. And I know that teachers have been working incredibly hard to implement all the technical guidance. That there's pages and pages of it that has had to translate into to practical sort of actions, and some of those have been cascaded down obviously to parents so that they know what to expect for their children over the next few weeks. But in the background, such as the testing and how that balances in with delivering education, which is the primary purpose of the children going to school, has been a difficult balance. But continuing working in the exemplary way that the Education Office and teachers, as well as Public Health, have in a group together, we'll get through this, and we know that this is a temporary situation, and everyone, in order to keep us as safe as possible, will step up to the mark as required.
Thank you very much. Those are very encouraging comments. Jim Delbridge.
Thank you, Deputy Fairbrush. Commercial and semi-commercial divers, can they recommence their business during stage 2? Can they go diving again? And will the decompression chamber at the PEH be open and operating? Thank you.
I'll go to Mr. Whitfield as much of that question as he can answer. I've got no idea because we haven't got Dr. Raby present. I don't know if Dr. Brink might be able to deal with it. She may not be able to. But Mr. Whitfield.
My understanding, and I would check, that actually that is being profiled for stage 3 at this stage.
Thank you. Is there anything you want to add, Dr. Brink, about the decompression chamber or whatever?
That's my understanding as well, is that we'll consider it in stage 3.
Thank you very much. Hamish, your question, please.
Thank you. Yes, for Deputy W. And I wonder, given that teachers have only had a week since they knew that they would be reopening again for more students from next week, what's the feedback been like from them? Have they felt they've had enough time to implement all the complex array of procedures in place to keep students safe next week?
Thank you for your question. We know it's been a really steep uphill climb for teachers during this whole period. It won't have been easy for them, even if we gave them 2 or 3 weeks notice, because of the extra added workload, because it's not just business as usual in terms of ensuring that they're delivering the learning to all the students and all the feedback that's required, but it's also planning to actually go back in physically, face to face, in addition to all the other personal issues that they have to juggle, like many other parents, working parents, have had to do as well. They've had an inordinate amount to deal with, but you know, they're ready and they're adaptable. That's the brilliant thing about the workforce, and I think that really clear guidance and shoulder to shoulder work with the workforce has taken place from the education centre as well with public health. So yes, I'm absolutely sure that they will feel under pressure, but it is something that everyone wants to work towards, and it's probably a little bit easier in a way than a phased re-entry into school. But you know, it's hard work all round. It is unprecedented times.
Thank you. Matthew from Bailiwick Express.
Thank you. Another question on the return to schools. We know that places on school transport will be limited. Have all the spaces on the buses been filled, and what measures are in place to accommodate students who applied late and potentially missed a spot?
Deputy Dudley Owen, can you answer that? Or is that...
No, I can't answer that. That's really a very detailed operational question, I'm afraid, about the numbers who have applied. And I'm absolutely sure that for those who may have applied late, that workarounds will be in place for them. But what we are doing, it's an opportunity for me to say to, especially given the weather, which, as you can see through my window, isn't great today, but the summer is on its way sometime in the next few weeks. We're in spring now, and active travel is being encouraged. So if children can walk or cycle safely to school, really to try and get kids out there and get them active. And obviously there's staggered times for parental drop-offs. But as I say, in terms of the public transport, that is limited. And also arranged transport is something that if any parent needs to look at that now and they haven't managed to get a place to their child, please do get in touch.
Thank you. Juliette Puto.
Just coming back to the stage 2 guidance, I've been busy looking through your website, which I think it's fair to say the guidance there is extensive. With one point of interest I found quite interesting was it did hint that prison visits are going to be allowed in the next stage, and so obviously haven't been allowed during phase 1 or during lockdown. But it did mention there's going to be very specific restrictions in place, but it didn't detail what those were. If people do need to visit the prison, what are the protocols in place?
Yeah, I'm going to ask Mr. Whitfield because he'll have, I'm sure, the best knowledge of that. But common sense-wise, I would think if you were going to visit the prison, you may well contact the prison service directly and say, I'm going to visit my whoever it is at 3 o'clock on a Friday. What do I have to do? But Mr. Whitfield, you may be able to add something to that.
Yeah, I think that's absolutely right. Those that do have a requirement to visit prisoners in the prison can get the information by contacting the prison, and it'll be the sort of procedures that we've now grown to expect with social distancing, good hand cleansing, sanitising will be carried out by both the prison staff and in the visits area. But if you're unsure and you think you need to prepare, then in the usual manner that those that have got relatives or others in prison, please contact the prison authority and they'll be able to explain what's required of you.
Okay, thank you. Ewan Duncan.
A question from a listener. When will face-to-face GP appointments be possible for routine visits?
For GP visits, did you say?
Yeah, sort of routine visits, visiting your GP when face-to-face allowed again.
Yeah, sorry, I didn't quite hear. That's me. Dr. Brink, I imagine that's stage 3, really, isn't it?
So, yes, they're doing a combination of face-to-face and telephone visits at the moment. So I think they're doing a blend of the two, but anyone who requires a face-to-face consultation is having that. That's part of normal clinical care.
Okay, thank you. Jim Delbridge, your question, please.
Yes, really just an administrative and reporting question for Dr. Brink. Are the states going to publish the running total of days without new cases again, like you had done previously? I know you update us every time we have this, but are you going to publish it in your figures in future?
We were intending to publish it, however, I almost don't want to jinx it, don't want to tempt fate. But yes, we will be intending to publish it as part of our daily figures that we put on. We intend carrying on reporting on a daily basis. I think it's what our population wants, it's what our population expects, and we need to provide islanders with the information they require.
Thank you. Matthew Leach.
Thank you. A final question from me today, and it's a question for Dr. Brink following the update on numbers of cases. It's been impressive to watch the numbers fall and see fewer and fewer positive cases being found in the community. You must now have access to a substantial amount of data. Has any further progress been made in establishing the original source of the outbreak, or is this something potentially we might never know?
I think it's increasingly likely that we'll never know. We've looked at possible sources that try to track it, but I think we've got to accept that this is probably something we'll never know. We are convinced that this was an outbreak caused by the Kent variant. So it was an outbreak from a single introduction source, but we'll probably never know what that source is, which of course is frustrating because you always want to learn the appropriate lessons. But I think the important thing is that we've learned a lot about the Kent variant and how it behaves. So, for example, we've modified our contact tracing processes in that we go back 3 days instead of 2 days before someone becomes symptomatic, because the virus tends to have a long tail either side. So we've modified some of our processes. And as I say, I don't think we'll ever know the source of that original introduction, unfortunately.
Thank you. Matthew, is this your final question?
Yeah, sorry about that. I've come up with another one. Condor's made numerous media statements about its plans to resume sailings this summer, and its CEO has spoken about its desire to relaunch services mid-May, subject to border restrictions being eased. Is that realistic, and have you had discussions with travel operators as they try to plan ahead?
The answer is that, as I said, we are going to get a paper next week. We're going to consider it next week, and then we should be in a position to make decisions and report the week after. I do not think we've been in detailed discussions with tour operators because we've had little to say. There's no point saying we haven't got any news for you. We don't know when the borders will be open. I think that is not an unreasonable position for Condor to say, but that's not soft speak or implicit speak to say that we've made a decision that things will be open in mid-May. We will consider it next week. We will report the week after. I don't see anybody else with their hand up. We're coming close up to 1:45 anyway. We may be able to start 1:45 a bit early, just before 1:45, because Deputy Salisbury, I can see, is chewing at the bit with these questions. So there we are. So if there aren't any other questions, I'll hand over to my colleague, Deputy Salisbury.
Thank you, Deputy Fairbrash. Well, we've heard from the President of the Committee for Education, Sport and Culture today, and we know Monday is a big day for children in Guernsey. Now, it's back to school, although we do appreciate it's not quite back to normal. Now, we had a fantastic bunch of questions through from children again for today, and I thank you to everyone who did send a question in. And sorry we can't respond to all of them, but what we've done is just collect those questions, those questions that were repeated more often than others. So here we go, the topics for today. So the first one is from Kenzie George, who's age 4. He says, I'm scared about going back to school. Will I be safe back at school with my friends? I say, Kenzie George, you don't need to be scared, but you're hearing it from me, and I think you really need to hear it from Dr. Brink.
So thank you, Kenzie George. And I think the first thing I'd like to say to you, if you are scared or worried, it's really good to talk to your mummy and daddy, but also possibly talk to your teacher when you go back to school. So it's better to talk about it and talk about your feelings and let people answer your questions. So that's the first thing I wanted to say. The second thing I wanted to say, Kenzie George, is that children don't tend to get very sick. So children don't get sick from COVID. It's really the older people that get sick. So I wouldn't be scared about going back to school because children don't get sick from COVID. The third thing I wanted to say is that your school will have done lots and lots of things to help keep you safe within the school. So when you go back, it's going to look a bit different. You're going to go in there, you're going to have hand washing, you might sit a little bit further away from your friends. Playground might look a bit different when you go out for your playtime, but all of those things are to keep you safe. So it's good that you talk about it. If you're still worried, talk to your teacher, talk to your mummy and daddy, but we're doing lots of things that we can keep you safe.
And that brings me to Amelie's question. She's age 5, and she said, what will be different about my school when I go back on Monday? And I think Dr. Brink has just said a few things. So I wonder if I can pass this on to my colleague, Deputy Dudley Owen.
Hello, Amelie. Thanks for your question. And yes, primary school will be a little bit different for you, Amelie, on Monday. You'll be in a bubble with your class, which means that you'll stay together with your friends in your class, but you won't be able to mix with other classes, just for now. And we hope it won't be long until you can, but you'll still be able to play outside during lunch and breaks, but it'll be make sure that you're in your little bubble with your friends in your class. And teacher will explain everything to you on Monday, so you're absolutely sure of what you can do and what's not quite allowed at the moment. But I'm sure you've had lots of fun things planned and you'll be so pleased to see all of your friends. But I think Dr. Brink's taken us through some of the more difficult things to understand about hand washing, etc. But maybe Dr. Brink might be able to just explain that a little bit more in detail about some of those other things that might be different at school than you've been used to.
Yeah, when you go back to school, what will happen is that you'll be, they'll talk to you about hand washing, so washing your hands, singing happy birthday ×2, so twice, really important, keep your hands nice and clean. If you cough or sneeze, do cough or sneeze into your elbow, not all over your hands and touch things. And also, your classroom will be a bit spaced out, so all of those things, but I wouldn't worry about it because your teacher will explain all of those things, and I'm sure your mum and daddies can explain them as well. So we're hoping that you'll go back and you'll have a lot of fun when you go back into your classroom, and there's just those little extra things that we need to do to keep you safe in the school.
Thank you, Dr. Brink. Moving on to the next question from Mason, who's age 13. He says, given that we've been told there'll be staggered start times for secondary schools, what time will each year group start and finish, and how long will it be for? I'll pass that on to Deputy Dudley Owen, I think.
Thank you. And Mason, I hope you're keeping well at the moment. It hasn't been an easy time, has it, over the last few weeks? I bet you'll be pleased to go back into school, but as you realise, things will be organised differently. And actually, each secondary school might organise things differently depending on their needs and their requirements and how their car parks are laid out, etc. So all that information has been sent by your school down to your parents, your carers. So if your parents haven't received that information, can you please ask them to contact school as soon as possible? And I'm sure that they'll be happy to send that out again. Because having the staggered start and finish times just helps to reduce the amount of people who are getting into school and leaving school at the same time. And it's all about trying to make sure that there's not large groups of people in one place all at once, which is normal when you finish and start school. It's often a little bit chaotic, isn't it? Well, we're trying to reduce that down. And because you'll be in at year 8 or 9, I guess, with your age, you'll be in a classroom bubble. So you'll have to stay with your classmates throughout the day. But when you get back into school on Monday, all of this will be explained to you by your teachers. And also, there's quite a lot of detail given in that email that I referred to earlier.
Thank you. So now we're moving to Molly, who's age 8 and has a lovely picture of her smiling away there, which is great to see. And she asks, when can I hug my friends at school again? Something for Dr. Brink, I think.
Oh, Molly, this is such a difficult one, and I know how difficult lockdown and being in stage 1 is, that you aren't able to see your friends, hug your friends, play with your friends. What I would say to you, Molly, is it won't be long now. We're doing really, really well. But when we go back to school, we just want everyone to be a little bit careful in the first part. If we keep doing as well as we're doing, it won't be too long. So really just hang in there with us, Molly. We hope that we'll be able to get you back to hugging your friends soon. But at the moment, we just want to be careful so we don't get the spread of the virus.
Thank you, Dr. Brink. Now, we've got a really good question here from Oliver, who's age 6. And he says, we have class bubbles and I'm happy, but I would like to play with my other friends. When do you think that'll be? Because I don't understand why we're allowed to see 4 house families now and mix at school in our bubbles. Why can't we just skip this stage? Because that's a lot of people mixing anyway. Now, it's a very good question, Oliver, and I think a lot of grown-ups have been asking the same thing. So I think, again, this is something for Dr. Brink.
Right, Oliver, I think you need to come and work with us in public health, Oliver, because I think you have real talent for asking really difficult questions. Really, it's the same as what I said to Molly. It's just doing it in step by step. So we're just putting our toe in the water, going a bit further, then going a bit further. But we're doing so well that I don't think it's going to be very long. But I really think that you need to come and join our team, Oliver. I think you'll be really good. Keep us on our toes.
Thank you. Now, the next one's going to be for Deputy Dudley Owen. It's from Susie, who's aged 11. She says, I am excited to see my school friends again, but I usually am allowed quiet time in the autism base at lunchtime. Now I will not be allowed to move from my classroom to the base, and I'm worried I'm going to find school difficult without my quiet time. How long will it be before I can go to the base on my lunch again?
Hi, Susie. I'm really sorry to hear that you're worried about this. But I completely understand why you are, because it's going to feel a little bit different initially. But we hope that that will just be for a short time. So once we're able to move to stage 3, things will start to feel much more normal. But I think it's really important that if you feel anxious when you're at school, that you please speak to your teacher and let them know, because they'll be happy to help you in any way that you can. And actually, they've got arrangements in place to help specifically for anybody who needs that quiet time. So if your mum and dad or your parents, carers can get in touch, please, with school and have a chat, and your teachers can explain exactly how this is going to work so that they can support you.
Thank you. And the next question is from Taylor, and she's age 11. And she's got a lovely smiling photograph as well, which is great to see. And she asks, would we get vaccinated at school like the flu jab, or would it be at the vaccination centre? And when will school children be vaccinated? Well, I think that clearly is a question for Dr. Brink.
So again, another public health practitioner in the making. Really impressive question, Taylor. So thank you for that. So the truth is that we're doing stuff and they're looking at how they can immunize children. But at the moment, we can only give the vaccine to older people, to people that are either over the age of 16 or over the age of 18. But they're looking at being able to vaccinate children as well. And we think we're going to hear more about that in the next 3 or 4 months. So at the moment, we don't vaccinate children unless there's a really, really special reason that we need to. But in the future, we may well vaccinate children. Now, whether we do that in the vaccination centre or at school, we haven't quite worked that one out, but maybe we can ask you to help us with that one.
Thank you, Dr. Brink. Now, Ollie, who's age 9, asks, I feel happier wearing my mask when I'm outside. Will I be okay going to school and not wearing it? That's one for Dr. Brink again, I believe.
Ollie, if you want to wear your mask on the way to school, that's absolutely fine. We want you to be comfortable with what you do. So if you feel, you've said here that you like to wear your mask outside, if you feel comfortable wearing it on your way to school, that's fine. Whatever makes you comfortable is absolutely fine with us. And if you're anxious or worried about anything, chat to your teacher, speak to your mummy and daddy, because we can give you a lot of information.
Thank you. Now, the next one's from Patrick, and he's age 2, and apparently he's almost 3. And he's got a lovely photograph here when he says, "When can I visit Puffin Rock, aka Herm, please?" It looks like he's a real fan there, but I'm guessing from the background. Dr. Brink.
Oh, that's going to be soon, we hope, very soon. I can quite understand what Patrick is saying, because I'm a massive Herm Island fan as well. So I think we all like going across to Herm. And as the weather gets better, we're going to be even more anxious to get over there. So it won't be a long time, Patrick. And certainly as the weather gets better, I'm pretty confident you'll be able to visit Herm then.
Thank you. And on a similar vein, we have Ava, who's age 5. And she says, "My birthday is coming up in 10 days, so happy birthday, Ava. When will I be able to have a party with my friends?"
I think Millie was going to answer that.
Yeah, I'm very happy to take that. And oh God, that's so exciting that you've got a birthday coming up soon, and happy birthday in advance of that. And I'm really sorry that lockdown has come at this time for you. And I know how hard that is, because 2 of my kids have had their birthday plans changed quite a lot because of lockdown. But one little tip that your mum might find it useful, or whoever's organising your party with you, that my daughter was invited to a Zoom party the other day, and she had fantastic fun. You could bake your cakes and have a really good chat with all of your friends online, and also play a game. They did a scavenger hunt at my daughter's party, and they were sent off in all directions around the house, scavenging for pieces and running up and down the stairs, so they kept active, and they really enjoyed seeing each other online. But obviously it's no substitute for celebrating face to face. So getting out and seeing your friends face to face is going to be the best thing. But gives you an opportunity to have 2 parties, doesn't it? One online and one in a few weeks' time, when we can get out in the fresh air, and you can have a brilliant celebration then as well.
Thank you. Yeah, hopefully it won't be long now. And talking about birthdays, we also had another birthday boy contact us, which was Savi, who turned 9 on Monday. So happy birthday to you too, Savi. So thank you all again for your questions. I hope we've helped explain what's happening and made you feel more ready and relaxed for next week, and are looking forward to meeting all your friends again back at school. And I'll hand over to Peter.
Thank you very much, Heidi, and thank you to the panel, and really to all the questions. First-rate questions. Well done indeed. I ask that my colleagues in the States could ask such receptive questions, but perhaps I'm asking too much. But in relation to that, the position is that Monday is a big step in lots of ways. We're nearly there. We're nearly there, but not quite there. And as Dr. Brink and all my colleagues have said, can people just be careful for the next couple of weeks or so, and then we will be there. We still have to be careful. We've always got to be careful, but we'll be there, and we'll have even more things that we'll be able to do. We're back again at 1 o'clock next Wednesday. We'll keep you informed. We should have more news for you then. And thank you very much for watching and listening, and thank you to everybody.